Hey, all.
Hi.
Welcome to and all of you out there, welcome to MFP Live. I'm Donna Ladd, the founding editor of the Mississippi Free Press, and I'm here with some kind of fabulous women here today to talk about a very special project and collaboration that we're kicking off really this month. First of all, I'll introduce you to Kimberly Griffin, who is the founding publisher of the Mississippi Free Press. And she and I have worked together for probably a dozen years on the Jackson Free Press, which covers the capital city. Hey, Kimberly.
Hey.
Welcome. And then down here at the bottom right is Azia Wiggins. And Azia is a very important person to this project. She's the executive assistant of the Mississippi Free Press, but on this project that we're going to be talking about today, Azia is the project coordinator and is really kind of making it all happen. So we are really happy that Azia is here to talk about it and to coordinate it. Welcome, Azia.
Thanks for having me. I'm glad to be here.
And then a really special guest here is Deanna Tisdale Johnson. Deanna is the the heir to an amazing historic newspaper here in Jackson, in Mississippi, but based here in Jackson, and she can tell you more about that. But Deanna is the publisher of the Jackson Advocate. Hello, Deanna. Why don't you kick it off?
Yes, I'm so glad to be here with you guys. I, like Donna said, am the publisher of the Jackson Advocate newspaper, which is the oldest African-American newspaper in Mississippi, founded in 1938. We just celebrated our 82nd anniversary.
Wow.
That is a feat in itself, and it's actually been in my family since 1978. I'm second generation, both my parents, my dad first, and then my mother second. Charles and Alice Tisdale were publishers of the paper, and now I am taking over the helm. I took over right as we had our first coronavirus case.
Right, I remember, right? Right around the time we started, you took over the Jackson Advocate.
Right.
That's right. And
so we're in this together.
That's right. And, I think we should pause here and just kind of make a historic point about this. First of all, both of these publications were, they're women run now, and yours is women owned. Ours is women founded as a nonprofit. But there were two very important newspapers in Jackson, based in Jackson in the 1960s. That were called the Mississippi Free Press and the Jackson Advocate. And so it's kind of, I don't know, I think that's really, and the Mississippi Free Press was a movement newspaper that was kind of a multiracially run newspaper. Medgar Evers was one of the founders, and Hazel Brannon Smith, who was a white publisher here, published it. And then the Jackson Advocate, that was before your family had taken it over, right, in the 60s?
Correct.
Right. But it was like you said, it's 82 years old. So it was, already at that point, it was already a very important Black newspaper in the state of Mississippi and in the country. So it's kind of fun that now we're working together in somewhat similar ways, and in a way, to have the two newspapers. So I love that.
Yeah, and definitely so. And there's so much interesting history. The first owner of the paper was Percy Green, who really actually did a lot for African Americans. But on the other side, on the flip side of that, was a very controversial figure.
That's right.
He turned out to be a spy for the Mississippi Sovereignty Commission.
He did. Wow. Yes.
Did not advocate on behalf of African Americans.
Right.
So having that duality as the foundation of the paper was very interesting. When my father took it over, he wanted to make sure that people knew that he stood on the side of right, and he stood on the side of making sure that African Americans in Mississippi, especially in Jackson, had their rights or were informed of their rights, and took the charge in making sure that we were advocates. So that's sort of the legacy that I feel like I'm leaning towards. But I think that it will come to fruition as we are in a digital age. So our website, as you can see on the screen now, that is our website, but we're revamping our website. It has been a long time coming, but it is almost finished, and I'm so excited for people to see it. We'll have a virtual launch for the new website, so I'm very excited to that. Excited about that. It'll be launched at the end of this year, beginning of next year, and I just really can't wait for people to have a community online, talk with us, be informed, be able to see what we're doing, the Jackson Advocate, and what we're doing as a collaboration with the Mississippi Free Press, because I'm really excited about that too. So
yes, me too. And you said that we kind of, in fact, I really kind of met you, even though we may have met before that in some ways, but at a luncheon right before COVID hit us here, and we were talking about media. Right at this, and that's when I kind of officially announced the Mississippi Free Press, and that's when I learned that you were taking over the Jackson Advocate.
That's right.
And so the way this little origin story of this project happened is that COVID hit, and we're all reporting what we're reporting, and I think it's fair to say that all of us were really noticing quickly kind of the disparities of how COVID, even though we didn't have good data in the beginning, but we knew anecdotally that COVID-19 was hitting the Black community really hard. And it wasn't long after that you and I just started having a conversation about that, and that maybe we should figure out how to work together on this project. And then Kimberly and I were talking about this very quickly. And talk about that a little bit, Kimberly, how you and I were just talking about this the other day about how we were both kind of worried about the disparities quickly.
So we had talked about starting the Mississippi Free Press, and we had a plan. COVID changed that plan. And then mid-March-ish is when, we had our first set of cases, and the escalation was quick. It went quickly. And both of us were noticing that we didn't have numbers about race. We didn't have numbers about gender. We didn't have really any basic demographic information. And, I would have people say to me, well, they probably didn't check the box. And I said, well, I don't always check the box, but I'm pretty sure my doctor tells the Department of Health what they think I am.
Right.
Yeah, like they make a guess.
Right.
Again, the neighborhood. And so it was clear that we did not have all the information. And when you don't have all the information, you can't protect yourselves and you can't protect your community.
That's right. Well, and I was telling you that early on after, we just kind of decided to launch the Mississippi Free Press to respond to COVID-19. One of the things that we were getting were story tips. We were new, but we also have this history in the state and this really strong journalism network because we've done the Jackson Free Press for so long. And so we were getting these tips from all over the state about Black communities or Black groups being hit so hard. And I remember that we got a bunch of Facebook posts, and someone was tipping us off about Tippah County, which is way up north, and how, and this was just in the first few weeks, and how COVID had kind of swept through a Black church. People didn't have good information. It's kind of what you're saying. And that there were a lot of kind of early deaths and infections that were associated with that. And so I think all of us started kind of demanding that information quickly, and it took them a while before they actually broke down this data. And I really think that it was as much as anything in response to this just public outcry, wanting to know what the demographic breakdowns were.
And it was one of the first, I guess, group of cases that really hit me hard was, Deanna, you may remember this, the Kojic bishops that all went to a funeral because they didn't have good information. And I didn't grow up Kojic. I'm not Kojic. But the Kojic Church is so important to our community in terms of their good works and their place of refuge for anybody who wants a place of refuge. And someone who's COGIC could tell you more, but I don't know. I think we had more than 5 COGIC bishops and pastors go to a funeral from Clarksdale and several other places in the Delta because a big member of the COGIC contingent had died.
Mm-hmm.
And it is clear that they would have made some different decisions if they had had better information. And so now we've lost at least half a generation of elders who didn't have the opportunity to pass on things to us that we all needed to know. They left void. Like, whole communities are now missing uncles and pastors and leaders. And because, we all know the Black pastor is often the school board member, they're the pastor, they're the place that's going to collect the money to make sure you go back to school, you get back to college. And that whole community had this void. And that one really was when I went, we need more numbers.
Kimberly, define real quick COGIC for people who
sorry, you're right.
We'll have some people watching who don't know.
The COGIC church is the Church of God in Christ.
Right.
And it is primarily African-American denomination, charismatic denomination that has some of its roots in Mississippi. So they have big contingents in Mississippi, Michigan, and Los Angeles. Kind of great migration. You'll see those different roots. And so they often have their convention in Jackson.
Fun fact, actually, is that Mount Helm Baptist Church, which is here in Jackson, is
that's the church I grew up in.
Right, it's the oldest religious body in Jackson, and 2 denominations are founded from Mount Helm Baptist Church. One is COGIC, the Church of God in Christ, and the other is Church of Christ Holiness USA. So both of those were founded here in Mississippi, and they're really big denominations across the nation, especially COGIC.
Okay, good lesson there. Now, Azia, talk a little bit, because, talk about why we ultimately decided to focus particularly on not African Americans, but Black women for this project, and about what some of the data that we've seen early on told us about, the infections and Black women.
Well, when it comes to doing what we set out to do with Mississippi Press, which is solutions journalism, we go to where there is no information. And when it comes to Black women in Mississippi, not just in the COVID stats, but in any other area, there's no information.
Right.
There's no information. So like Kimberly was saying, in the beginning, they didn't have any demographic, they didn't have any breakdown, except for, how many cases, once it got around, April, May. And then it didn't really get down to break it down by race and gender till later on in the year. Maybe June, July, the summertime. And we actually start getting those numbers. Even right now, even Issaquah, according to our data, they still don't have any data. I know it's a small, the population is only 1,000 or so, but they don't have data because that's not being done. Those, just because it's a small amount, that those are Black women not matter. Do we not need to be trying to figure out how to, collect this data and get down to the issues of why the numbers are the way they are? And there's a lot of reasons why.
Well, and I think they've released some out of Issaquah, but it's not enough.
Yeah. Right.
Well, and what we found, and Deanna can jump in here anybody can jump in here anytime, but Deanna especially. But what we found once they started releasing the data, was exactly what we were all suspecting. It was that it was hitting Black communities very hard. When they released the race and gender, like by race and gender, which I think didn't happen as soon as by race, if I'm remembering that right. Black women jumped out in Mississippi as being hit very hard, and as I understand it, that doesn't track exactly with some of the other states, even where Black people were being hit harder. Black women in Mississippi were being hit very hard. And that's what got our attention. Yeah. Like, as Mississippi Free Press, as we don't just report on and to women, but we are women focused. So that got our attention. And then can you talk a little bit more about that, Deanna, when you started noticing that it was Black women in particular, and then maybe a little bit about why you think that that is.
Right. So when they started just across the nation, started releasing data and statistics about how the COVID virus, how COVID-19 was affecting people. A lot of the stats at first were saying, okay, this virus is really hitting Black communities the hardest. A disparaging amount of African Americans were hit hardest, disproportionately across the, across the US. But then, you started to kind of get each state piece by piece. So in one state, there were Black men that were hit hardest. I think it may have been Illinois or Michigan, what was one of the earliest reports. But when you start looking at Mississippi, once the data was released, which, like we stated, kind of took a while, that's when you kind of got the statistics are a little bit different than other states. You saw a lot of Black women being disproportionately affected by COVID-19. And I think that's because, and talking with Dr. Dobbs as well, Dr. Thomas Dobbs, who's over the Mississippi State Health Department, he was saying that Black women are being hit the hardest because we're the frontline workers. We're the essential workers. We're in the grocery stores. We're nurses. We're doctors. We're everywhere on the front lines. We're factory workers, and we're taking care of our families. We're who you call when a family member or a community member is sick. So we have been hit the hardest because, we're always on the front lines. We're always the essential workers and the essential people in our lives. Whether it's just church, you're going to have a mother of the church. You're going to have someone that's going to try to cook for you if you're sick, or, a caretaker in the home that's caring for an elderly person. You're going to have nurses in the long-term care facilities. You're going to have nurses in our hospitals. Like I said, factory workers, we're everywhere taking care of those who need us. And that has been one of the things that has put us in a vulnerable position. Two, we're also very, it isn't where we're going to kind of have a really good trust factor with the health department, with the health system in Mississippi either. So that trust and the lack of access to adequate health care for African American women is also a part of the problem. So those are the two factors that I think have really led to a disproportionate number of African American women being affected by COVID in Mississippi. Is we're not taking care of, we're always taking care of others.
Right. Well, and when we started talking about that, I think what that really kind of, where that got us, I think, in the conversation was you, as a starting point, those facts are there, but then what is that layered on top of systemically, right? Now, what you're talking about is systemic, but what are the multiple factors that even being an essential worker that often comes with that, right? In so many different ways. Or for a lot of the women in our state and others, but Black women particularly, are living places where they don't, in rural areas and such, where hospitals have closed, right? Where they don't have good health care, right? Don't have, benefits, health insurance for various and assorted reasons. Then you get in, and you get into so many other issues, right? And so I think what we were talking about quickly, all of us, was that this is an opportunity to look at Black women in Mississippi, arguably the poorest state in the union. Sometimes we end up at 49, but we'll say it poorest. You know, competing with Louisiana or something. But it's our opportunity to take this crisis and say, what are all the reasons we can figure out that made this true? Some of them may even surprise us, right? And then, and I think this is something that Kimberly talks about some, it's like, what are the differences between, we can't assume that every Black woman lives in the same circumstances either, you know. Right. So what is, and as Azia had really suggested calling the project, you know, equity and resilience, because it's not just about, you know, being in difficult, it's about being resilient and rising above some of these difficult circumstances. But we really saw it as an opportunity to get at a lot of these systemic causes that a lot of people in our communities don't always understand. A lot of policymakers don't understand, and kind of use this focus to bring out those stories. Kimberly, you want to take it from there, because Kimberly is doing one of the things that's kind of a cornerstone of the Mississippi Free Press's plans as a solutions outlet, is both to find these causes and report the solutions, but also to hold these, to let people tell us what they want to tell us through these virtual solution circles. And you want to talk a little bit about how we're using those solution circles to get at the information?
Yeah, so we have convened at this point 3 solution circles with essentially the same cohort of Black women of different ages, of different backgrounds, of from different regions of the state. And we probably could call them listening circles. So we ask them, how has COVID affected you? And how would you fix, what solution would you give? And one of the things we always say is, you don't have to implement the solution as you are so used to doing. You just have to tell us what you think the solution is. And, you know, we've learned so much. One of the things we learned from 2 people is that they are people that do a lot of contract work. And what and now that you don't go somewhere to do your facilitating or your consulting, that they had an income increase, but they also realized they were working themselves to death. And that just come to them in the last 30 days is that they were working too much because they could. We've learned so much about internet access around the state. And it's not that people don't have internet. They don't have adequate internet to do 4 and 5 people in the home on the internet working and doing school. Because a lot of these homes have everybody back in the house, including 2 college students and 1 person in high school. And now 2 people working, 2 parents working. And our infrastructure, our technological infrastructure is not set up for that. In most cases, if you're paying for the most expensive, most wonderful internet and you think it's wonderful until you're under the back of this kind of stress, it doesn't work, which puts everybody kind of in a compromised situation. So we have really just done a lot of listening, and we've learned a lot, and we're going to use the things that we've learned. Deanna has been sitting in on those circles to really inform some further research, coupled with what Azia's doing. So Azia's done a lot of the data pulling and finding, you know, holes in the research and showing us the trends. But we want to marry the trends with that conversation, because when you're in those circles, what you'll find out is that people are, there's a trend in there, Deanna. Like, people are saying, yeah, it's you know, actually we're okay, or we're not okay financially, whichever way. But these additional stressors are, I've got my entire 3 generations of my family in my home now. I have got, you know, in addition to the fact that I can't see my parents and I got to go drop off there's just so many layers that are in the data, but also sometimes explain the data. So if you are the person that's responsible for example, somebody my age, I have a friend who's a physician. She has a daughter, a grandchild, and parents that she's responsible for. She's a physician. That I you know, and we can talk. The journalist among us will have a wonderful piece about this in 2 years. But one of the things I suspect we're going to find out is we are going to have some serious mental health repercussions sooner rather than later.
Yeah.
And that's one thing that kind of stuck out to me in one of the solution circles is I think one of the members, hopefully I can be able to say this, but just expressed how much rage. You know, that's a strong word, but it kind of has, you know, a string that you can pull and see like where it's like this is after decades, literally, from before Fannie Lou Hamer, from God knows where, but rage against the system and how it is failing us, and how with this pandemic we can actually see, everyone can see, whether you were blind before or not, you can see there are cracks. You know, there's a big, you know, hole, there's a crater almost, you know, in this system that we have created that has left Black women as the most vulnerable people in Mississippi.
Yes.
You know, it shows us that we are vulnerable and that we are still doing what we need to do. We are still taking care of our families. And some of us are flourishing, creating new businesses like Azia has talked about before in conversations, coming up with new businesses, being able to just get things done. It's not all bad, but it speaks to the strong backbone of a Black woman. It really just speaks to how much we do and how much we keep going and how to survive. We are almost fueled by that rage, but it has repercussions. You know, how long can we keep going like that without, you know, some really solid prayer and a really good therapist? You know, we got to couple those together. And really, the third component is the solutions. You know, figuring out what we really need to do to fix this systemic problem or these systemic problems for the future of our city, state, and nation. Because as the saying goes, when Mississippi does what it's supposed to do, the rest of the nation will too. If Mississippi doesn't do what it's supposed to do, the rest of the nation won't do it either. You know,
right? And we keep blaming Mississippi and not dealing with our own stuff too.
That's right.
Well, and I think what you're saying there really kind of taps into kind of easing us into talking about the project itself, right? But when we were all talking about this over these months, I think we all saw it as an opportunity, right? In the sense of how can we expose what you're talking about to a larger audience? Because the truth is, despite the remarkable resilience that we're talking about among Black women with what they've faced forever in the state of Mississippi, right? A lot of the solutions need to come from a larger community, from policymakers and from people understanding what the problems are, right? And that the problems are varied, and where are the holes in the net and all of these other things. And you referred to Fannie Lou Hamer. I kind of wanted one of you guys to talk for a little bit about the disparities in the healthcare system and the discrimination itself against Black women that most white people just don't even know is true. You know, I've seen a lot of this year as more things kind of come out, a lot of people being surprised to hear that a Black woman can't get the painkiller she needs because there is this racist assumption that she doesn't feel pain in the same way. So somebody take that one on, whoever wants to jump on this historic discrimination in the attitudes.
I'll say
Okay.
a few words and then I'll let Deanna or Asia. I mean, it's I guess it's hard for me to talk about because it's been my whole life. Do you know what I'm saying, Deanna?
Yes.
Like I walk in with the expectation that you aren't going to believe me, that I'm going to have to over explain myself, which is why most of my physicians are Black. But you know, if they aren't, I am a person of extreme privilege. I have several physicians in my family, several close friends, and I will just put them on the phone and have a friend that's rheumatologist. She goes, I don't know what they're talking about. This is not my area. I was like, it doesn't matter. Just say you're a doctor. You know, so, but you know, I just had a family member in the hospital, not from COVID, and no one my brother's very nice. I'm less nice. And so they wouldn't listen to us at all. You know, but but we come armed with the understanding that we won't be listened to, believed, belittled. You won't really try to get to the bottom of what's really wrong. You'll assume something is going on that's not going on based on whatever, how many of us probably, I wonder how many Black people on high blood pressure medicine don't need to be because you're over 40 and they put you on high blood pressure medicine.
Yeah, the statistics.
Yeah. So, my physician friends, I get real irritated with the what is it? You're predisposed because you're Black. We predisposed to everything. So that's what we struggle with. And, you know, even more so with COVID, because I wonder how many people haven't been properly diagnosed.
Mm-hmm. And so many people that I know, even for a time, you know, probably myself, didn't really have someone like a family doctor that they could just call and say, hey, this is going on. You know, that relationship. Mm-hmm. It really wasn't until I actually have my best friends, my childhood best friend's mom is a doctor. So I've always kind of grown up with knowing that I could call her if something was wrong, you know, but it wasn't until I got married and I saw the relationship that my in-laws have with their doctor, that if, you know, something happened, they could call him and he'll refer another doctor that he trusts, and they trust in that. So they keep that cycle going. Whatever, you know, he recommends, they will really do what he says, and the results will be beneficial for them. And that's the first time that I've really seen trust, you know, kind of go both ways in a medical sense. And, you know, I just got married 4 years ago. So, you know, I was a grown adult before I really saw that type of relationship between, you know, someone and their doctor. And it was really great to see. It gave me a little bit more hope that really the medical system in Mississippi is not really always out to get us, that there are good doctors who will help in the time of need, you know, real need. And I've seen Facebook posts from friends who are my age who've had horror stories as it concerns, you know, childbirth, when the doctor did not believe them when they said that something was hurting them, you know, and that they thought that something was wrong, you know, and if it weren't for them sticking to their guns about what they believed, they might not be here. You know, those types of things. It's just, believe me, believe what I'm telling you. I know I'm not a doctor, but I might know my body. You know, believe that I know something is wrong and help me. You know, that it seems simple, but it's a struggle we're dealing with now.
Well, I was at the Robert Wood Johnson conference that was here last year, and I met a Black woman doctor who had been just devastated and she's from Brooklyn, I think, or somewhere like that, not here, right? Who was telling me just in tears about a situation like this, about not being able to get the proper medical treatment. I mean, she's a doctor. I mean, and so I think this is really important to put out there to almost kind of frame what we're talking about here, that there are a lot of things that people do not understand, white people particularly, who don't have these same kind of, you know, racist barriers. I'm not quite sure what else to call it, right? That are built in, that you have to go through, you know, this like dance to get a doctor to believe you is just horrifying.
And that's right? When you have insurance, you know, like.
Well, I know, right?
Uninsured.
So if you don't have insurance and you don't trust the doctor, or if you have insurance and you don't trust your doctors, then it's like maybe you're not doing everything preventative that you need to be doing, for instance. I mean, you know, we all know, you mentioned Fannie Lou Hamer. I mean, she was one of the Black women that they did what she later called a Mississippi appendectomy on, where they sterilized her without her permission up in Ruleville, you know, and that was, you know, that happened to some poor white women too. But, you know, this kind of thing is built in. And so to kind of, I think I'm going to come to you, Azia, here. So it's like, as we're building this solutions project, the first thing we have to do is figure out the causes, because you can't solve things if you don't actually know what's causing it, right? And we're just now kicking it off. And I want to say that we got a wonderful grant from the Solutions Journalism Network for this project to support our collaboration, that we're working together on this project. And we've just, Azia is coordinating this, so she can kind of tell you about the team that she's put together and the training that they're about to do.
Yes,
yes, I know, I'm excited too. But and she's going to be a walking solutions journalism expert before this is over. She was in a training today, and then she's going to do another one tomorrow. So we're very excited. But because we want to do as a team here, we want to do deep solutions journalism, looking for the causes, including these systemic things that people don't think about. And you know, whoever the people are, right? They may be things we don't think about among the group that we discover along the way, but also what some groups may not think about that other people experience, to expose this systemic problem so that then we can, and this is what solutions journalism is that then you do deep, rigorous journalism about what potential solutions are, whether they're solutions that are coming out of communities that are already doing it well, or even potentially looking at out of state for what is happening somewhere else. So Azia, why don't you kind of take it from here and tell folks how the project is shaping up right now?
Well, right now we're doing a lot of data collecting. I mean, we have so much data to go through from different venues, different programs like the Black Women's Roundtable. They have 67 pages of data to go through. And just looking at how things are, really, I feel like the group right now is data collecting, because, like you said, we don't know enough about the women and why the numbers are the way they are. And so I think if we could start to show people, or start our pieces by showing how we're going to do the data collection in Mississippi, and how we can take that data and get down to the root of the solutions. Can you guys hear me?
Yeah, that's a little bit better. Yeah.
Sorry, these earphones are.
That's okay. That's okay. It's virtual. It is what it is.
But yeah, so like I was looking at a study by Dr. Michelle Albert in San Francisco. They did a piece with, I think, the Heart Association. They're giving them grant money for her to do her research. And I love what she's doing. And basically what she's saying is we have to get one of the main things, especially in coronavirus, is the underlying conditions. And Black women are going to put that, whether it's diabetes, heart disease. And so she's doing an extensive study to collect that data first, so we can go ahead and get to a solution of how to solve these issues. And I love that. And then they're here in Mississippi, and not just Mississippi, but all over the nation. So just taking models like that and seeing how we can expound upon them, just like Donna said, also unveiling some things that we didn't expect, right? I'm hoping that we get into these counties in Mississippi, interview the people from there, build a relationship with these people there, and really hear their voices, to understand what their concerns are, what their needs for their communities are. Really hear from real Mississippi voices.
Mm-hmm. Well, and we invite those voices. to get in touch with us, you can. By the way, if you write solutions@MississippiFreePress.com, Asia's going to get it. So
I am. Please write me.
So any kind of ideas, any kind of ideas, or if you'd like to be interviewed, people all around the state, please get in touch with us. Tell us about the team that we've put together and this training that you guys are about to do, because we're kind of tickled about this.
I am, and I think the team's excited. We have a good, now that I think about it, we have a good, I mean, it's mostly Black women. We have a few Black women videographers, Black women photojournalists, Black women freelance journalists. We have one young man, Jarius, which I think he worked on the MFP Trusted Election Project.
Jarius. Yeah,
he's awesome. I just love his energy. His first email to me was like, Asia, I'll do whatever you need to do. Just let me know. And I was like, I loved it. And he's just on point.
Deanna sent him. Yeah.
With what can I do next? How can we get into this data? Like, they are ready to go. Everybody really, like from Torshita, Deanna, everybody's been sending us my emails. Everybody's sending our information in. They are ready to go. And I'm excited to see what we do together.
I'm excited.
And what are you doing tomorrow? Tell them about the training.
Tomorrow we're doing some solutions training. We have a session with Michael, who was one of who works with Solution Journalism Network. And it's going to be kind of like a more hands-on kind of, explainer or refresh, not just refresher course, but for those of us who are new to solution journalism, want to know what's it about, how to do it. That's what the training will be about. And so they're all excited about the training as well. Because most of the team are reporters and writers or aspiring journalists, and they excited about solution journalism and what it's really about. And being, really one of the first in Mississippi to really get into it. Like I tell them, like, I feel like we're going to make history. And so let's, have our hearts about it and really, be excited to do the work.
And let's just be frank. We're training a core of journalists here who can, work in our newsrooms in the state, who can go outside the state and do this work. And that's, look, you talk about, DEI now, diversity, equity, and inclusion. And this is one way to help the media industry. What better, I mean, the way I look at it is, what's better than having native Mississippian Black reporters who are trained in rigorous solutions journalism, who are here at the root of so many of, America's problems right here in Mississippi, who can do this journalism. So, I mean, we're all, I think I can speak for this whole group when I say we all are excited about that piece of this to help kind of lift the quality of journalism across the state in many ways, kind of lead on this in some ways. Two, we should be doing this rigorous solutions journalism. And one thing I want to say to people, because people will ask what solutions journalism is and isn't. And what it isn't is kind of hero worship kind of feature stories. Now, I'm not saying, I've probably published a lot of stories that would qualify as that. And we probably will, especially, especially we've done that. Yeah, not a problem. We want to write about people doing good things. This is different though. And that's why you need training in it. It's really about deep diving into what a potential solution is, or one that's already underway, and finding out the pitfalls, that what's being done wrong. I'll give you all a very quick example. We did a whole archive of solutions journalism work at the Jackson Free Press, supported by the Solutions Journalism Network. That was on what we call preventing violence. It was doing the same thing though, looking for the systemic causes of violence, particularly in young people, right? So it's kind of doing what we're doing, looking for the bigger issues. But long story short, I was doing one that involved a project that they called Brave here in Jackson, which was this, it was supposed to be this project, this approach to policing that is both, we're going to threaten you if you do something bad and you're going to get in trouble. At the same time, we're going to help you get services so that you avoid doing those things. I have mixed feelings about the project and the approach in general. But what I found when I got into this, into the reporting on this, is that they got a grant. The police took the grant. They split it up among different local, agencies, and just increased police sweeps. without ever doing the services part. So that's a really good example of how you can use solutions journalism to do investigative reporting about what isn't being done that should be being done. You follow what I mean? And then the other thing is that then you can go other places. We can't travel as much right now, but we can talk to people in other places, whether inside the state or outside the state, and find where it's working. And then do a story about that. And then those people will actually tell you, well, here's what to watch out for because we really messed this part up. And so you can include that in your journalism. Like it wasn't until we did this prevention project that I knew that Natchez had a really impressive juvenile justice approach. Rankin County handles juvenile detention a whole lot better than Hinds County does. I didn't see that coming, right? So, so that's what we're getting at when we're talking about solutions journalism. It's work. What it's not, though, is this kind of partisan divide about doing journalism that pleases Republicans or doing a solution that pleases Republicans or pleases Democrats. It's about getting past all that stuff and saying, what can we really do that can work in Mississippi? So, Azia, on so talk a little bit. Our approach is talk a little bit about how we're planning to, pick different counties around the state and what we anticipate doing with the data piece of it.
Well, we anticipate, doing a comparison project. Like we don't want to just go to the predominantly Black counties. We want to also mix in predominantly white counties, right? So we can really see the measure of disparities when it comes to healthcare, when it comes to what the hospital, the amount of hospitals in the city or in the county. You want to really compare the differences from that, as well as, we do other counties as well. Some with bigger populations that are predominantly Black, some with smaller populations that are predominantly Black. So I think for these first few months, we could, we want to do at least 4 or 5 counties. And as we, continue with the project and hopefully get more, funding to continue on, we can continue to expand into different other counties in Mississippi as well and do a more investigative approach in those other counties as well.
Mm-hmm. And the way this works is that our initial grant is for the first 3 months of the project. And so what we've done up till now is like the pre-work, figuring out all of us talking, figuring out what we want that project to look like, Azia's not talking it completely. She has a science background too, so it kind of works out, science training. But she's doing a lot of research and potential solutions around. But even if you research solutions journalism, like you can go to that solutions journalism website and see they have, they call it a tracker, I think. But you can actually search there, even if you're not in journalism. Search on COVID-19, search on violence as we did, or crime, search on any number of things, and actually see stories pop up that are being done around the country about potential solutions to problems.
Around the world, actually.
Right. Well, that's right. That's
globally,
right.
Yeah.
That's right. And and the funny thing is that I wish, if we could just get elected officials and policymakers and to even use that tracker to see what these potential these potential solutions are. But then as the journalistic side here, one of the things Azia and I and the team will, and I'm more of an advisor on this. They're kind of taking the lead. But one of the things that we'll be doing is kind of looking at some of the stories to back up into some of what the problems were too, in case we missed something, right? So it's a really fun kind of journalism, and the solutions journal. And I sound like an advocate, but I really am, because I love this approach to journalism. It's not problems journalism. You got to figure out what the problems are and why they came about. But we're really not going to do a story that's like big headline, start with statistics about a certain group is hit harder by COVID. Everybody already knows this. This is not news. What can be news here is why.
Why? How?
Right? And how, and then what to do. And who's done it. And did it work? Did it not work? What can we learn from them? And so that's kind of our approach. And what we find is that everybody we talk to is really excited about this idea that we're actually going to look for solutions for Mississippi, yes. Right? Rather than just getting page views from reporting the problems, because we're in Mississippi, we kind of know the problems are there. So kick back up to you, Kimberly. What would you add to anything that we were just saying there?
This isn't necessarily a journalistic point as much as it is a Mississippian point. The reason I'm super proud of this team is as a person who is not a journalist, but is a journalism fan. Mm-hmm. And Donna and Deanna get less mad about this than I do, I think. I get furious when people parachute in, whatever they do. Oh, somebody did something and they have one big outcome. And everybody acts like Mississippians and haven't been here. Mississippi journalists have not been here working this hard for decades. Mm-hmm. And those people get, all these grants and all this kind of stuff. And I just go, Deanna's parents have been doing toil and tear. What is the spiritual song? Toil and tear for decades. Mm-hmm. The Jackson Free Press, our other publication, almost 2 decades. We could name publications that are no longer with us who have done the work day in and day out to keep democracy safe. Mm-hmm. Now to keep our health system, now we're exposing health disparities. And so for me, I'm just excited because I think it's going to position Mississippi journalists to really show what we have been doing and will continue to do.
That's right. Yes. And that we know. Right. Go ahead, Deanna.
I just wanted to say I'm so excited. I think, like Kimberly said, that my parents, they were doing solutions journalism before it was a thing. It may not be in the same way, but partnering with the NAACP and other organizations, making sure that if someone is being treated unfairly, my dad would go to court with them, make sure they had a good lawyer. If somebody couldn't pay their bills, that came out of money that we had either at the Advocate or out of our family's pocket. That words are so powerful, that members of the Ku Klux Klan would shoot up our offices, mm-hmm. or other people firebombed our offices because of what was being told. And so I think that's because there was a change being made. It wasn't just, this is what's happening, okay, let's, go on to the next story. It's like, this is what's happening. Let's do something about it. Let's go out in the streets and get it done. And I mean, solutions journalism is a little bit different from that. But I think the effect can be the same. And that's why I'm really excited about it, because it's a new way of doing things, but it needs to be done. We have to look at and do the deep dive into the systemic problems that we have, because there are so many of them that keep creeping up every day. The crime in our beloved capital city, just the disparaging amount of people that we see that are living below the living wage. And that's just 2 things. The list could go on, and I know we're running out of time, but I'm really super proud of what we're starting with this. It is very true that there are news publications that pop up and take credit for the work that is being done and has been done. But you know what? I told myself I was not going to fight over pennies when God has thousands for me. So, and maybe millions, you never know.
Yeah,
so I know what the work we're doing is going to be monumental. In 20 years, I'll look back and be proud of what we're doing. And so we have to keep our eyes on the prize, as they say. That is the most important thing.
Amen. And you know what? And we got to plug a little here for woman power in Mississippi too. You know, I mean, I don't even think I have to say too much else with that, but you know, this is this project, like you say, I think Jarius is our only guy, you know, and we love Jarius.
That's the only name I saw.
I know. But, well, we intentionally designed it. I mean, from the very beginning, if at all possible, we wanted the journalists who are doing the work to be Black women, because it's about Black women. But it's also because we want Black women trained in this journalism, and we want them, Black women from Mississippi, to proliferate out around the state into journalism, go outside the state. Well, we don't want them to leave, but you got me. If they, you know, they should be, if a lot of Black women from Mississippi were doing more in the echelons of media in this country, we'd have a very different approach to things. And we all kind of know that, you know, so all of that is part of shirts.
Black
I know. I'm honored to be surrounded by all of you guys, and to really to collaborate in the way that we're doing. I mean, that's what's really fun, to have this many native Mississippians. You don't have to be native. I'm not sure every journalist is on the team, but that's fine. But for us all to work together this way, to expose the things people haven't wanted to look at for so long, and then to kind of say, we're not just exposing it and to leave the sore open, right? We're exposing it so that we can then work together to try to figure out what to do about it. We're also doing this, and we're doing an there's Darius. I was just on a Zoom call with him and the rest of the voting team. So like 30 minutes before this one. So I've had good Jarius vibes today, but so that we can, you know, we're doing it in voting, like we're just talking about. We're doing the phase 2 of our voting project next. We are open to collaborators. I mean, you know, Deanna sent us Jarius, and he's a vital part of this project.
She sent us a few people.
Yeah, I know. Well, that's the thing, and we're trying.
Half the team is from Deanna.
This is what we're doing, and we do want to throw out. If you're a good vibes kind of journalism outlet that isn't intimidated by strong women and who want to do the kind of work, we're gonna have a few, you know, kind of rules out there, but who wants to do the kind of work that we want to do, we are happy to talk to you about collaborating as well. And whether it's on this project or other projects, you know, come talk to us about that. But you know, you have to be serious about the collaborating, and that at the core of it is changing Mississippi for the better. That is our ultimate goal. That is why we're coming here. This is it. It's why we're here. If we, you know, if you win awards or something else along the way, that's nice. But why we're here is to make Mississippi better, and that includes this kind of training that we're doing of people who are right here in Mississippi. So we don't need all these folks parachuting in as much. We can do this kind of level of work ourselves, which I think both of our publications have long shown. Our existing publications. So
I said I was gonna bite this off of Biden, but my personal motto for next year and all that I do will be build back better. I'm gonna I'm just gonna build back better. That is my motto for next year. So whatever I do, I'm just gonna build back better.
That's right. The mission is at the core here, and that's the thing. And we invite anybody who wants to help in some way with this project or some of these other projects that we talk about. Get in touch with us. Again, if you write solutions at the email address that's on the screen, you're going to get us. and so we can get back in touch with you. So we're super excited about this project. You're going to hopefully, you know, we hope that you start seeing some initial journalism this month, that we will be, that both of our publications will likely be publishing, as well as, other publications can run the work that we're doing in this project for free. And so we just kind of want you to know that. So you can get in touch with us about that. So it is a collaboration. We invite other people to come into this. And I'm just tickled to work with these fabulous women and the others that we're going to be working with, and Jarius.
Yes, I'm all for Black women leading the charge, not just in Mississippi, but in the nation. And with solution journalism, is want to be impactful for Black women leading the charge here in Mississippi, because the solution journalism is about the relationship between the public and the media. And we have got to mend that by giving the people real journalism, real stories, real objective facts, so they can be like, wow, I didn't know that was an issue, you know, and really look forward to, like, not only are we reporting the bad news, we're reporting what you can do, how you can be helpful, what's happening in your community. And we need it. And I'm all for Black women leading that, especially here in Mississippi.
Love it. Anybody else? All right. Well, thank you, folks out there watching this or who are going to watch the video later. Thank you so much for tuning in. My next MFP Live, I just kind of confirmed like minutes before getting on here, it's going to be Heather McTeer-Tony. 2 weeks from today at 5 o'clock. And if you don't know, Heather was the first Black woman mayor, or maybe Black woman mayor, I think, of Greenville, if I have that right, Mississippi. But now she works with she's an environmentalist. She was in the Obama administration working for the EPA. I've seen she's on a short list now for something, but anyway, I don't know about that. I'm not quoting her on that, but there was a Politico story or something. But she's also on the Mississippi Free Press board of directors, and she works. It's Mom's Air Force. Did I get that right? Yeah. Right, which is about environmentalism, and she's also an expert on environmental racism. So we're going to be talking about those things 2 weeks from today. Heather's a dynamo, so you guys are going to want to tune in for that one. And what else? Yes, me too. We run our pieces at MississippiFreePress.org. And then other than that, I would say for the Mississippi Free Press, we have our News Match fundraising. We're nonprofit. We have our campaign going on to the end of December. It's going super well so far. And we're young, so all of these funds are going to help us build our team in 2021. So if you can donate, right now we have a Mississippi expat who's doubling your donations. So you can go to this link on the screen and give whatever amount that $5 we love, $5,000 we love. We don't care. Whatever you want to give and can give, we welcome that. And to help us with this campaign through the end of the year. And we really appreciate everybody who's donated to date. You're just making a whole lot possible, and all your fabulous comments help us a lot. So, and also if you'd like to be a match, let us know that, if you have a little bit of money and you want to say, hey, I can match a certain amount, you can get in touch with us and tell us about that. And also we're going to be at some point here, we're not officially doing it yet, but we're going to be raising more funds, especially for this project. And so if you get in touch with us and tell us that you want to donate particularly for this project, we will earmark those funds for this project, okay, to help pay for our freelancers and public records requests and that kind of thing. So you can get in touch with us and tell us that. I think I would suggest on that you can get in touch with Deanna or Kimberly on that. Kimberly's email address is kimberly@MississippiFreePress.org. And Deanna's what's yours?
It's dtjohnson@thejacksonadvocate.com.
Right. Or just post in the chat over here if you didn't get any of that. Oh, our producer is getting things up for us there. So Kimberly@MississippiFreePress.org she prefers, but I think it'll go to her if it's .com as well. And then Deanna's address. So just get in touch with us if you'd like to give funds to earmark for this particular project. We can totally do that. Darn it. Okay, the producer's getting punchy back there, so we better get off. But this was, thank you, ladies, so much, and for allowing me to work with you on this project. I'm super excited about it, and we're going to do really important things. I know it.
Yes.
Thank you. See you guys in 2 weeks.
See ya. Good night, y'all.
Bye.
Bye.